Hey guys, Dr. Bryan Wills here. Welcome back to another Wellness Wednesday. Hope you guys are having a great day. I know it's hot outside, so make sure you're drinking plenty of water. Last month we talked all about injuries, prevention, kind of what to do. This month what we're going to talk about is actually some of the most common injuries we see, kind of how to take care of them. So we're going to start with the most common thing we see in a chiropractic office, which is low back pain. Obviously, low back pain affects a tremendous number of people throughout the year. It's responsible for millions and millions and millions of dollars in lost wages, lost time at work, and hospital visits as well. So there's two kinds of low back pain. There's chronic low back pain and acute low back pain. So acute low back pain is when you actually injure your back. It's the small sprains and strains that we do. You know, we have all these weekend warriors that go out and are cutting down trees and doing yard work, and you bend over and you kind of just feel that little tweak, and all of a sudden the back pain starts getting worse and worse and worse, and it builds and builds and builds. Those are acute injuries. It's no different than spraining your ankle. It's just in your low back. Okay, so it's going to be characterized by a lot of sharp pain, inflammation, swelling, those types of things. Chronic low back pain is actually when you've had back pain that's lasted longer than a month, or that's just a reoccurring back pain that you have over and over and over again. So a lot of our patients come to our office and say, yeah, I throw my back out 3 or 4 times a year. It's basically the exact same back pain, just recurring over and over and over and over again. And the thing I always like to tell patients is, if you cut your finger and your finger didn't heal up for like 10 years, would you be concerned? And most people say, well, heck yeah, I'd be concerned. Well, your back injury is no different. If you're having the same back pain again and again and again and again, obviously your body is not able to heal that injury, and that should be a big red flag to you and to us that something's going on. Chronic low back pain is going to be characterized, again, maybe not as sharp as a pain, but it's still going to be kind of that debilitating pain that just lingers on and on and on, or again, just pops up over and over again. So some of the most common traits that are common causes of low back pain, again, are lifting improperly, also just being out of shape. Now, a lot of the muscles in your core aren't strong enough to stabilize when you're lifting things. So you have a lot of, again, weekend warriors that spend their entire week sitting at a computer desk, especially now during this whole pandemic thing. Everybody's sitting around on their computer or watching TV or streaming Netflix. They really aren't engaging their core, aren't doing the things they should be doing. Then they run outside on the weekends and they go cut a tree down, or they're landscaping their yard, and that leads to, again, them injuring their back. Chronic low back pain has a lot more to do with being overweight, as well as being out of shape also. Okay, so we want to make sure that we're conditioning our core, strengthening our muscles, not carrying on a bunch of excess weight, which really puts a lot of stress and strain on that low back. Chronic low back pain is one that's pretty serious, because chronic low back pain is going to be caused by some degenerative process. So either getting arthritis in your spine, some kind of disc problem down there, and those things don't go away. One of the most famous things we always hear from patients is, Doc, I thought that it would just go away. And it never does. Okay, it just lingers on and on and on. And the more that it lingers, the more damage has been done, and the longer it's going to take to fix, more money it's going to take to fix as well. So if you're experiencing chronic low back pain again, it's either coming back over and over and over again, or that's lingering longer than 30 days, you need to get to a chiropractor immediately to figure out, number one, what's going on, and number two, how to correct the problem. Chronic low back pain almost always comes from acute low back injuries that just don't heal properly. So if things don't get lined up properly, the tissues don't heal the way they're supposed to, it turns into an arthritic problem or a disc problem, and all of a sudden you've got all kinds of irritations and damage down there. So it's really, really important, if you injure your back, get to a chiropractor and make sure that things get healed up properly. Or if you have chronic low back pain, making sure that we fix the problem, because if you don't, it's going to lead to a disc injury. And unfortunately, we see those all the time here, where somebody comes in, they've damaged the disc, which we'll talk about later this month, and they're looking at surgery at that point in time, because there's just not much left for us to deal with in there. So again, if you do have acute low back pain, the best remedy for it is ice. Remember, we talked about ice versus heat. Ice is really, really important. I know ice doesn't make you feel very good while it's on, because it makes you a little stiff, but it pushes a lot of the inflammation away, which speeds up the healing process. Obviously, ice, get into your chiropractor, make sure you're getting adjusted, make sure the body heals properly and does what it's supposed to do. We also do traction therapy as well. It can be beneficial with acute low back pain, electric muscle stim, and obviously some physical therapy to help strengthen the tissues around there. Chronic low back pain is kind of a little bit different. So the ice really isn't as important, But it's really important to get in and see a chiropractor and make sure things get lined up and the body heals the way it's supposed to. Also the traction therapy that we do, and again, some of the PT stuff as well. So what I want to do is I don't want to spend a bunch of time showing you exercises on this video. I don't want to take up too much of your time today. So I'm going to put in the comments below some links to some videos of exercises that are really, really key to strengthening up that core and make it nice and stable, so that you don't have to worry about bending over and hurting your back, or injuring your back because you're not strong enough to be able to lift things. So hopefully you found this beneficial. Again, ice, don't ever heat is the most important thing. Again, with chronic low back pain, you clog until all of a sudden one day you have this huge heart attack and you have no idea what's going on. Chronic low back pain is the same way. You have this thing that lingers, and all of a sudden you bend over one day and you totally herniate a disc, and then you're staring on the barrel of surgery there. So we don't want that. So make sure you're getting in here, getting adjusted, getting checked out, make sure things are functioning well. So again, check out the videos below and in the comments below. They're really, really helpful. They're simple and easy exercises, but it's so important to maintain that kind of the health and integrity of your low back in there. So until next time, guys, keep living the dream.